This slide introduces PNF Techniques, which stands for Proprioceptive Neuromuscular Facilitation. It's a method used to improve physical function, flexibility, and strength by working with the nervous system and muscles. The image shows a practitioner assisting a patient, demonstrating the hands-on nature of these techniques. This approach helps enhance movement and coordination through specific exercises. This slide provides an introduction to PNF. PNF is a technique that aims to improve mobility, strength, coordination, and functional movement. It utilizes proprioceptive input, which involves the body's awareness of its position and movement, to enhance neuromuscular control. The image shows someone using resistance bands, which is a common tool used in PNF exercises to promote muscle activation and coordination. This technique helps the body relearn movement patterns and improve overall physical performance. This slide details the basic principles of PNF. It incorporates diagonal and spiral movement patterns, along with the use of the stretch reflex and manual contacts. Verbal cues and resistance are also applied to guide the movements and enhance muscle activation. The image shows the interaction between the practitioner and the patient, highlighting the collaborative nature of these techniques. These principles work together to improve neuromuscular control and physical function. This slide highlights the benefits of PNF. It helps improve range of motion and flexibility, as well as enhancing motor learning and coordination. PNF techniques also contribute to strengthening weak muscles and provide functional carryover into daily activities. The image shows someone participating in a guided stretching exercise, illustrating how these techniques can improve physical capabilities. By enhancing neuromuscular control, PNF helps people achieve better physical function and mobility. This slide introduces rhythmic initiation, which is a technique used to help patients initiate movement. It follows a progression from passive to active assistive to active and finally to resisted movements. This technique is particularly useful for patients who struggle to start movements and is commonly used in Parkinson's disease rehabilitation. The image shows someone performing a guided movement, demonstrating the supportive nature of this technique. It helps improve movement initiation and coordination. This slide explains the hold-relax technique. It involves an isometric contraction of the target muscle, followed by relaxation and a stretch. This technique is effective for increasing flexibility and reducing muscle tightness. The image shows the practitioner assisting a patient with a stretching exercise, demonstrating how the hold and relax phases are used to improve flexibility. This technique is beneficial for individuals with tight muscles or limited range of motion. This slide explains contract-relax, a technique that involves isotonic contraction against resistance, followed by relaxation and a stretch. It's effective for increasing range of motion. The image shows someone performing a stretching exercise, which demonstrates the application of this technique to improve flexibility. Contract-relax helps lengthen muscles and increase joint mobility. This slide describes slow reversals, a technique that involves alternating isotonic contractions of the agonist and antagonist muscles without rest between movements. It helps improve coordination and strength. The image shows someone performing a controlled movement with assistance, demonstrating the alternating contractions involved in slow reversals. This technique enhances muscle control and functional strength. This slide describes alternating isometrics, which involves isometric contractions of the agonist and antagonist muscles alternately. This technique promotes stability and postural control. The image shows someone receiving resistance, which demonstrates the isometric contractions involved. Alternating isometrics are useful for improving core stability and overall balance. This slide details rhythmic stabilization, which involves multi-directional isometric contractions. It's designed to enhance balance and trunk stability. The image shows someone performing a stabilization exercise with assistance, demonstrating the application of this technique. Rhythmic stabilization helps improve stability and control, particularly around the core. This slide describes the upper extremity D1 flexion-extension pattern. Flexion involves shoulder flexion, adduction, and external rotation, like reaching to feed yourself. Extension involves shoulder extension, abduction, and internal rotation. These are diagonal, functional movement patterns. The image shows someone performing an upper extremity movement, which demonstrates these diagonal patterns. These patterns are used to improve upper extremity function and coordination. This slide describes the upper extremity D2 flexion-extension pattern. Flexion involves shoulder flexion, abduction, and external rotation, like brushing your hair. Extension involves shoulder extension, adduction, and internal rotation. These are diagonal, functional movement patterns. The image shows someone performing an upper extremity movement, which demonstrates these diagonal patterns. These patterns are used to improve upper extremity function and coordination. This slide describes the lower extremity D1 flexion extension pattern. Flexion involves hip flexion, adduction, and external rotation, like crossing your legs. Extension involves hip extension, abduction, and internal rotation. These are diagonal functional movement patterns. The image shows someone performing a lower extremity movement, which demonstrates these diagonal patterns. These patterns are used to improve lower extremity function and coordination, particularly in gait activities. This slide describes the lower extremity D2 flexion extension pattern. Flexion involves hip flexion, abduction, and internal rotation, like stepping sideways. Extension involves hip extension, adduction, and external rotation. These are diagonal functional movement patterns. The image shows someone performing a lower extremity movement, demonstrates these diagonal patterns. These patterns are important in sports and balance training, helping to improve lower extremity function and coordination. This slide discusses clinical applications of PNF. It's used in neurological rehabilitation for conditions like stroke, spinal cord injuries, Parkinson's disease, and multiple sclerosis. PNF is also used in orthopedic rehab for postoperative recovery and sports injuries. It enhances functional activities like gait and activities of daily living. The image shows someone receiving therapy, highlighting the role of PNF in rehabilitation. It helps improve physical function and quality of life. This slide summarizes PNF techniques. PNF uses diagonal movement patterns and resistance to improve mobility, strength, coordination, and stability. The various techniques discussed are widely applied in both neurological and musculoskeletal rehabilitation. The image shows someone participating in PNF exercises, illustrating the practical application of these techniques. Overall, PNF is a valuable tool for improving physical function and quality of life.